My name is Habyarimana Flandri, coming from Rwanda. I'm the current president of Rwanda Community Pharmacists Union and the regional representative of Commonwealth Pharmacists Association in East and South Africa. Currently, antibiotic resistance is a serious problem, threatening both developing countries and developed countries. The antibiotic resistance in many countries is caused by lack of adequate surveillance system. There are so many ways that can cause antibiotic resistance. Inappropriate use of a drug by patient promote antibiotic resistance. The resistance of microorganisms to antibiotic is increasing because of poor or limited diagnosis. Sometimes patients have viral infections but end up using antibiotic. In this case, the drug will totally be ineffective.
I'm called WAAW Mukandabarasa Monique, senior pharmacist. I'm qualified with 2 master's degrees, and I'm working with a public institution called Rwanda Social Security Board. I'm in charge of pharmaceutical operation. I'm director of pharmaceutical operation unit. I'm also a member of Commonwealth Pharmacists Association. We are talking about antimicrobial resistance. When people come into a pharmacy here in Rwanda, they have to present their prescription to the pharmacist. Someone can make a mistake and come without a prescription. Automatically, in a kindly word, we have to advise the person. First, go to hospital or any health facility to have a prescription before to come in a pharmacy and get the antibiotic.
Drug resistance is a major public health problem that requires a range of interventions and multidisciplinary terms approach. Doctors do character tests before prescribing the antibiotics, provide appropriate guidance on treatment options, and every time a review is necessary to assess whether the organism is responding to the drug or not. Before you prescribe an antibiotic, you must confirm whether infection is responding to the drug you prescribe or you chose. Every time be sure if laboratory test is done.
The recommendation of WAAW, people should only use antibiotics when that antibiotic is prescribed and needed. But we always educate them not to share antibiotics. A course of antibiotics is just for one person.
To my colleague as a pharmacist, be sure if a prescribed antibiotic, if any dispensed antibiotic is appropriate to the patient. To other health professionals, stop dispensing antibiotics without prescription.
The message of this week is to educate our population, our people, to a proper use of antibiotic. Essentially, to use properly the prescribed antibiotic and to finish the entire dose in due time. The second point of it is not to do auto-medication with antibiotics. Never confuse antibiotics and another over-the-counter drugs. That's why it should be dispensed only with a prescription. Thank you.
I call everyone to be the guardian of antibiotic. The appropriate use of antibiotic is the right way of preventing antibiotic resistance. Thank you very much.